Assalamu alaikum wa rahmatullah. I am Isam Al-Amin from Department of Obstetrics and Gynecology. I would like to welcome you all, student level 7 Physical Therapy Department. And today in this lecture, I am going to talk about high risk pregnancy.
First, let us talk about
Definition of high risk pregnancy. What is the meaning of high risk pregnancy? Pregnancy considered as high risk when this pregnancy is complicated by any condition which can harm the mother or baby before or during birth. It means that during pregnancy and when the mother is pregnant may have some condition or some disease that affect the mother, and this condition is dangerous to the mother, to the fetus. So this pregnancy with such type of condition which is dangerous, we call it high risk pregnancy.
let us discuss
What are these conditions? We call some of these conditions as high risk factors. This high risk factor can affect mother, fetus, or newborn. It can also this factor or this condition occur before, during, or after delivery, cause increased risk of sickness or death of baby or mother. One of these conditions which can affect the baby or the mother is placenta. We call it abruptio placentae. This one of the condition that affect the placenta, and it occurs when the placenta separates from the uterus before delivery. Usually placenta attached to the wall of the uterus, and this is normally for some reason part of this placenta separate, and this is a high risk factor or high risk condition can affect both mother and baby. Another risk factor or another disorder which can be considered as high risk, prematurity. Normally the baby take around 40 weeks inside the mother abdomen and deliver after or during 40 weeks. After 37 weeks, this is considered tear, and tear means complete the period should stay in the abdomen. Sometimes, for some reasons, the woman can deliver before tear or before the fetus complete 37 weeks. This we consider as premature. Another disorder is preeclampsia. Preeclampsia is a condition or disorder due to high blood pressure during pregnancy. The blood pressure raised and there is a proteinuria. Both these conditions, high blood pressure and proteinuria or protein in urine, this is called preeclampsia, which is a dangerous condition, can lead to convulsion or fits during pregnancy if untreated can lead to death of the mother or the fetus. Another disorder is polyhydramnios. What is polyhydramnios? Polyhydramnios means usually the baby inside the mother is inside a sac and inside sac in water or liquid and membrane covered by sac and heart's membrane. This fluid usually called liquor. This liquor and this fluid has normal amount. If increased, we call it polyhydramnios. If increased more than normal, it will be called polyhydramnios. And this liquor, if decreased, or this fluid around the fetus decreased,
Usually, we call it oligohydramnios.
Oligohydramnios if it decreased. If it is increased, polyhydramnios. If it decreased or less than normal, we call it oligohydramnios. Another condition is growth restriction. As you know, the fetus usually grows and increases in weight, in size and in weight, and this should be within normal range. If we discover that the fetus cannot gain the normal limit or the normal range of weight and is smaller than the weight in that age, so we call it this is growth restriction or failure of growth. Means that failure of growth. And this failure of growth can be discovered if there is good follow-up during pregnancy. Another serious condition or disorder it is chromosomal abnormalities. As you know, congenital anomalies most likely due to chromosomal abnormalities as Down syndrome. This is one of the most common congenital abnormalities. This disorder, if happened or occurred during pregnancy, we consider this pregnancy as high risk pregnancy. There are some disease and some condition that can lead to the death of the mother. Mother can die, baby can die. Like thromboembolic disease. What is thromboembolic disease? This is coagulation or blood clots found in the blood vessels, veins of the lower limb, so we call it DVT, deep vein thrombosis, or blood clots occur in the lung, in the chest, blood vessel of the lung, and can cause what we call pulmonary embolism. Sometimes blood clot occurs in the lower limb, legs, and sometimes migrate till it reaches the blood vessel of the lungs, where it occludes blood vessels there and can lead to the death of the mother. Another disorder is hypertensive disease. This high blood pressure during pregnancy, which can lead to convulsion and fits, which we call seizures. Also the dangerous and can lead to the death of the mother. Another condition is hemorrhage during pregnancy and after birth. Hemorrhage means bleeding during labor or during delivery. Also during antenatal period, the mother can bleed from what we mentioned before, abruptio placentae or placenta previa. Mother also can cause infection and infection by microorganisms, bacteria or viral, and some bacteria can cause toxicity in the blood, which we call sepsis. This can transmit it from the genital tract or from anywhere in the body and lead to septicemia, which is dangerous, which can lead to the death of the mother. We have a fatal condition also called ectopic pregnancy. This is where the pregnancy occurs outside the uterus. We call it ectopic pregnancy. Suppose in the tubes or on the ovary or in the abdomen. Anyhow, it is outside the uterus, the normal position of implantation is the uterus. So ectopic pregnancy is a dangerous condition, can lead to the death of the mother. Look at the other minor or less risk factors that if happen or if occur or if found during pregnancy, consider pregnancy as high risk or dangerous pregnancy. One of these is the age. Between 16, less than 16 years old, this consider the woman is young, or over 35, where we consider mother is old. This carry risk for high pregnancy. So low socioeconomic status, poor, these are poor people, because we consider poor people as high risk pregnancy. Also maternal weight less than 50 kg, less weight, less than 50, small, this is a risk. Poor nutrition, those who are not well nourished, consider there is lack of some nutrient and we consider high risk pregnancy. Any woman who is in the past history she have delivered premature baby or deliver a baby less than maturity, less than 37 weeks, or patient or women with previous history of recurrent abortion or recurrent miscarriage due to weakness of the cervix, malformation, any abnormalities or congenital abnormalities of the mother, and also smoking, drugs, alcohol abuse, alcohol abuse, and smoking. All these are risk factors because you know drugs like heroin and other, morphine and other, alcohol, all can reach the fetus and affect the fetus and affect the pregnancy, affect his growth, lead to many complications during pregnancy. So better to avoid all these alcohol and drugs addiction during pregnancy. As I mentioned before, infection also is a high risk condition. This infection will be minor or be severe, like urinary tract infection or chest infection, pneumonia. And the condition, the pregnancy itself, it may be twin pregnancy, 2 fetus in the abdomen, or 3 fetus. This is a high risk, considered as high risk pregnancy. Anemia. Anemia means low hemoglobin. Anemia, low hemoglobin, it is a high risk pregnancy. Abnormal fetal presentation. This usually the fetus comes by his head or lie in the abdomen longitudinally, his head down. Sometimes this presentation is abnormal. The fetus comes by his buttock. This also we call abnormal fetal presentation. Before labor, sometimes the sac where the baby in the abdomen, it open or rupture, leading to drainage of water. Water comes out before labor start. For some reasons, this is high risk pregnancy. Lastly, also is placental abnormalities. Sometimes placenta localization, usually placenta in the fundus of the uterus or up posterior uterus, but sometimes you could find the placenta lie in the lower segment, sometimes covering the os. The placenta is rich of blood, so this is a high risk condition which can lead to bleeding or hemorrhage and can lead to death of both mother and fetus. This risk factor and this condition should be known during pregnancy or before pregnancy. Why? We should know this condition before pregnancy so as to manage this condition. How? Usually in medicine, if you want to know the risk or to know the disease or to manage any disease, you should start with history. You should ask the patient about his medical history. Secondly, you do an examination to the patient and you do investigation. Then you assess the patient. Exactly, if we want to know the high risk condition of pregnancy, we should start with history. Initial history, we should ask the mother about her age because certain diseases are common in certain ages. Also, we should ask about past medical history. Some disease affect the mother since she was born. We should ask about the disease like hypertension, disease, epilepsy, and so on. We should ask about her family history because some disease run in the family like sickle cell disease, like diabetes, and so on and so on. Also, we should ask about race and ethnic background or the country of origin, where she from, because certain diseases are common in certain population. We should ask if the mother had babies, she delivered babies before, we should ask her about past obstetric history, the mode of delivery, the outcome of her pregnancy, any associated condition during that pregnancy. In past medical history, we should ask about chronic hypertension. We mean by chronic hypertension, this is a high blood pressure from before pregnancy. The mother could tell you that she received treatment for hypertension, antihypertensive, before pregnancy or 5-6 years before pregnancy. This is what we call chronic hypertension. She can tell you about kidney disease, diabetes mellitus, this high sugar in the blood. She can give you a history, or you should ask about heart disease, any type of heart disease, any congenital heart disease. You should ask also about previous surgery and sickle cell disease. You should ask about any malignancy in the family, like cervical cancer, uterine cancer. Ask about sickle cell disease. Ask about substance abuse. Substance abuse means using some drugs. Ask about also thyroid disease or pulmonary disease. Pulmonary disease like chest infection, like tuberculosis. Most important is bronchial asthma. And also ask about any gastrointestinal liver disease or epilepsy. Epilepsy is a disease of convulsion or fits. Also, you should ask about blood disorder, anemia, and clotting disorders. Anemia, low hemoglobin before, and ask about clotting disorders. After you finish your history, we should do examination. Examination include temperature. We check for temperature because high temperature usually due to infections or due to malaria or due to pneumonia, chest infection, or infection of the membranes. That membranes, as I told you before, the fetus inside the mother, the fetus inside the uterus, it was kept in a membranes inside water. This membrane sometimes got infection from the genital tract. The bacteria or the microbe migrate from the genital tract from outside and infect these membranes. This is a dangerous and high risk condition. We can discover it by temperature. Usually we found the temperature high, and in this condition, this infection or this disease can lead to premature delivery. The fetus can deliver before death, before completing 37 weeks. So we should treat this condition by giving antibiotic or deliver the baby immediately. Also, we should check for blood pressure. If we found it more than 140 over 90 mmHg, this is considered high blood pressure, and either we should differentiate either pregnancy-induced hypertension. What is meant by pregnancy-induced hypertension? This is a pregnancy which occurred during pregnancy. Patient normal blood pressure, but after she become pregnant and after 20 weeks, suddenly her blood pressure raised and became high. This we call pregnancy-induced hypertension. Means that pregnancy caused by hypertension. Chronic hypertension, I explained before, it is hypertension or increased blood pressure before pregnancy. Also, we should check for pulse. Pulse, if we found pulse more than 100 beats per minute, this means high or rapid pulse. It is due either to infection, fever, or due to anemia or to heart disease. We need follow-up. If it is minor and severe, we need to do ECG, CBC, more investigation, and to treat the patient with help of cardiologist. Also, we should do urine test for protein, glucose, muscle, blood detected in urine. Further investigation for diabetes, kidney disease, if we found this is a primary test, we do urine. If we found protein or glucose or muscle, then we do further investigation for diabetes. If we found glucose, protein, if you find protein, kidneys, and we should treat the condition by giving antibiotic. Now, after we do or take history from the mother, and we assess the mother by history, by examination, by investigation, we need to also to evaluate the baby inside the mother. We have 3 tools to assess the fetus, so as to know whether the fetus or the baby inside the mother is healthy and comfortable and happy. One of these tools is to ask the mother about the baby movement. Is her baby moving? Is her baby usually moving? And how many movements per day? So we should ask her to count the movement of the fetus during the day, and we tell her some limits. If movement is less or not moving at all, she should revise her hospital or her doctor for further assessment. Another tool is ultrasound examination. As you know, ultrasound examination is done by a machine, ultrasound machine. I will show you a picture. This machine has a probe and a screen. The screen shows you the picture and photo of the baby inside the mother through a probe. This probe outside the mother abdomen, put outside mother abdomen, sliding up abdomen, and reflect the picture. So you saw the picture and you look for certain things. In this ultrasound machine or this examination or in this video, you will look for the amount of amniotic fluids. As I told you before, the baby is swimming inside a sac full of fluids. This fluid has normal amount. Then you measure this amount and you measure this fluid. If it is normal, this means that the amniotic fluid is normal. If it is more, we call it polyhydramnios, or less, we call it polyp. Another thing, you look for fetal movement, fetal heart movement. Heart is beating well. You look for chambers of the heart, whether it is normal or abnormal. And you look also for chest movement, which we call fetal breathing. Also, by ultrasound, you look for placental location, whether it is in the fundus, whether it is posterior, or whether it is lower, which I told you before, it is a high-risk pregnancy for what we call placenta previa. Or you look also for if there is separation of the placenta, what we call appropriate placenta, which is a high-risk pregnancy. One of the most important use of ultrasound is to follow or to monitor the growth of the fetus. You assess the weight of the fetus, and after sometimes, usually 2 weeks, again you assess the weight. And you see if there is gain weight of the fetus, this means that the fetus is okay and is growing well. If you found after 2 weeks that the weight of the baby is not increasing or decreased, this means that the fetus is not growing well, and what we call growth restriction or IUGR, what we call sometimes IUGR. One of the most important tools is electronic monitoring of baby heartbeats. This is what we call CTG. This is a machine called CTG, as you know, or we call it cardiotocography. CTG stands for cardiotocography. This is a machine, has 2 probes. I will show a picture in the next slide, which bring out the heart rate and the uterine contraction simultaneously, and you can assess whether it is normal or abnormal. If it is normal, during normal limits, fetal heart, this means that the baby is okay and alive and well. If it is abnormal, then you should deliver the baby as early as possible to save his life. If you look here at these pictures, you can see in the upper left the ultrasound machine here. This is ultrasound machine, and this ultrasound probe and the screen. It should be put on the upper abdomen and sliding over the abdomen, and it will give you or reflect you a picture of the fetus and membranes. Here, this is a picture in the lower right corner. Look, this is the head and the bucket. This is a bucket of liquid, which I told you before. This is the genitalia, the male baby. This is a placenta. So you could see all, and you could assess the fetus Liker is okay. Position is cephalic, that the head come first. This is the cervix, head come first. And so it's a normal lie, normal position as presentation. And the liker is okay, normal. So you can by ultrasound assess. And sometimes you could take measurement of the head or of the abdomen. In the upper, there is a printout of CTG, what we call CTG trace. This is a trace showing that the fetal heart rate, upper line is the fetal heart rate, and lower line is uterine contraction. So after you print out, connect the probe to the mother abdomen, and after you connect the probe to the mother abdomen and you bring out CTG trace, then you read this CTG trace, which reflects the condition of the fetus, whether it is comfortable, well, and okay. You will wait for normal delivery. If any problem regarding the CTG, then you terminate or expedite delivery, or you finish the delivery by cesarean section or by normal vaginal delivery. Well, why you are doing all this? Why you are taking history? Why you assess the patient? Why you assess the fetus? Why? The answer or the aim of this is to recognize the risk factor as early as possible so that special care can be given to the patient, to that patient. So we need to discover the condition or to discover the risk as early as possible so as to manage. Some condition we need, or this interference, our interference can be done before pregnancy. If we know that the patient has diabetes mellitus or has hypertension or any condition, we need to manage this or to optimize her condition before pregnancy, and we should give her, allow her to get pregnant by using contraception. And after we see that her disease or her condition managed, optimized, then we will ask her to, she can get pregnant after that. Also, and we have to try our best, or we should try our best to treat any disease, as I told you, optimize outcome of the baby and mother. And one of the most things that if we discover any high risk pregnancy or condition, we should advise the mother to deliver in the hospital. So as is the best place for her to deliver is hospital, not to deliver in home, so as to follow or to adjust her condition. This is our aim of discover all high risk pregnancy. First of all, or in conclusion, what is the high risk pregnancy? High risk pregnancy is that any pregnancy with condition or dangerous condition, disease or anything that harm or affect the mother or affect the baby, or even can lead to the death of the mother or lead to the death of the baby. This is what we call high risk pregnancy. How we will know or how we will discover this risk pregnancy? By taking good history from the mother, by examining the mother or the woman, and by do investigation to the mother. Also, we have tools to assess the fetus inside the mother abdomen by ultrasound machine, looking for placental localization, for big liker, for position of the baby, growth of the baby. Also, we can do CTG or monitoring or assessing the fetal heart rate of the fetus. And after that, if we found the baby, all these investigations are okay. This means that the fetus is okay. and we will follow the fetus and we will follow pregnancy. And another thing, if you found any risk condition, you increase the antenatal visit of the mother. You ask the mother to come more frequent to antenatally to her doctor, to visit her doctor every week or every 2 weeks. Or another thing, you advise her to deliver in a hospital. Thank you, and thank you very much for your listening, and I hope to see you in the next lecture next week. Thank you very much.